Hi, it's the nurse here. As I approach the area, I check the area for anything that could be unsafe. I can confirm that the area is safe. I also make sure that the patient has privacy. I close the door. To perform hand hygiene, I put a palm full of hand gel into my hands and follow the 7-step World Health Organization technique. Palm to palm, right palm over left dorsum with interlaced fingers and vice versa, palm to palm with fingers interlaced, backs of fingers to opposing palms with fingers interlocked, rotational rubbing of left thumb clasped in right palm and vice versa, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa, then 30 seconds to dry. Hi, my name is Sonna and I'm the community nurse. Your GP, Dr. Sheeran, asked me to review you here rather than come into the surgery. Before we begin, can I please check your preferred name?
Mavis.
Okay, Mavis. Before we start, can I just check you can hear and see me okay?
Yes, no problem at all.
I've been asked to come to see you for an overall well-being check and to assess how you're doing with your memory at the moment. Is that all right?
Yes, that's fine.
Okay, well I hope to be able to help you with that. Before we begin, I'd just like to do a quick ID check. Do you have any photo ID with your name, address and date of birth on?
I don't, sorry.
No problem. Are you able to confirm your full name and date of birth?
Yes, my name is Mavis Bickman. Date of birth 15th of March 1941.
And how about the first line of your address?
8 Swan Terrace.
I've confirmed that the patient ID is correct and so I can continue. Mavis, can I check? Do you have any allergies? Drugs, food or latex?
Just penicillin.
And what happens when you have penicillin?
My throat closes up and I can't breathe.
Okay, we'll make sure you don't receive any of that. How are you feeling in yourself, Mavis? Are you okay to continue?
Oh yes, okay.
Okay, so I'd like to conduct a full assessment to look at your overall health before we look at how you're performing cognitively. Are you happy with that?
Yes, that's fine.
Okay, before I start then, can I just check if you need to use the bathroom?
No, I'm fine, thanks.
And are you comfortable? Are you in any pain at all?
No, I'm fine, thanks.
Okay, so before I start my assessment, so we normally start with airway. I can see that you are speaking normally and there does not appear to be any obstructions, so I believe your airway is patent. In terms of your breathing, could I just ask you to unbutton your shirt a little so I can see your chest? Lovely. And if I could just ask you to lean forward a little bit whilst I feel for your lung expansion. And take some deep breaths. You do feel as if you have equal and bilateral chest expansion, which is good. I just want to perform a quick oxygen saturation test on you now to measure the amount of oxygen in your blood. Can I use this finger?
Yes.
I note that there is no nail varnish or fake nail on Mavis's hand, and it is not cold or clammy to touch. If I could just ask you to rest your hand there for a minute or so and remain calm and quiet so we can get an accurate reading, that will be great. Whilst the oxygen saturation is calculating, I'm going to perform a respiration count without telling Mavis so that it won't change the results. I'm starting the clock at exactly 8:04 for 1. Okay, so your oxygen saturation is 97% and your respiration rate is 19. Those are both normal results. I want to assess Mavis's circulation now, so I'm looking at her skin palette for any irregularities, such as paleness, sweating, a blue or mottled look. Her skin looks pink and well perfused. Mavis, I just want to feel your hands and feet now so I can check their temperature. Is that all right?
Yes, that is fine.
And is it okay if I just have a quick look at your feet?
Yes, that is fine.
Okay, your legs,
Your hands
pink,
and feet
warm,
are both nice
and
and
well
warm,
perfused,
which is good.
with no signs of rashes, bruises or bumps, swelling or edema. In clinical practice, I'm
just going to perform a quick capillary refill to check your circulation. I'm just going to press down on your fingernail for a moment. Is that okay?
Yes, that's fine.
I'm just going to apply a little pressure to the nail bed for 5 seconds and then count how many seconds it takes the blood to return. Okay, so the colour returned after 2 seconds, and anything within 2 seconds is normal, so that's fine. Looking at you, Mavis, I can see that your skin colour is normal. You have some colour in your cheeks, which is good. However, I'd also like to take your pulse so I can assess your heart rate. Is it okay for me to use this wrist?
Yes, that's fine.
Okay, I need your arm to be supported at a 90-degree angle, and I'm just going to palpate your artery and put my fingers in the little groove in your wrist so I can measure the rate, rhythm, and amplitude of the pulse. I just need you to be calm and quiet for me for a minute or so in order that I can get an accurate reading. Is that okay?
Yes.
Assessor, I'm commencing my observations at 8:07 a.m. Your pulse is 85 beats per minute, which is within normal range. I'll move on to take your blood pressure reading now. Do you mind which arm I use?
This one is fine.
And is it okay for me to roll up your sleeve?
Yes, that's fine.
Can I just check that you haven't had any recent trauma or surgery on this arm?
No, nothing.
Okay, I'm checking the arm and I cannot see any signs of redness, inflammation or infection. I cannot see any signs of lymphedema or arteriovenous fistula either. And have you been resting for the last 20 minutes, Mavis?
I have, yes.
Great. If I could just ask you to please keep your legs uncrossed because sometimes that can affect the result.
Sure.
Wonderful. The blood pressure cuff I have here is the right size for you, Mavis, so I'm just going to palpate your brachial pulse before I attach the cuff. I will put the centre of the bladder in alignment with the brachial artery when I apply the cuff. I've checked that the machine is working.
Just ask you to please.
Okay, I can now see that you have a blood pressure reading of 140/90, which is in the normal range, but it is on the higher side. Is that a normal reading for you?
I think so. Sorry, do you know where my husband is? I haven't seen him yet this morning.
I'm sorry, Mavis, but your husband passed away a few years back now. Do you remember?
Oh, okay, I see.
Let me know if you'd like to talk about it.
No, I'm fine.
I will now move on to the disability assessment, and we'll begin by assessing Mavis's AVPU. Mavis is alert and conscious, but I will ask her some follow-up questions to assess her orientation. Mavis, do you know what day it is today?
31st March 1982.
Okay, that's a little while ago, Mavis, as we're actually in 2023 at the moment. Do you know where you are?
Yes, I'm at home.
Mavis is oriented, but is confused on the date.
However, I know she has Alzheimer's, so I don't believe that this is new confusion. I will mark her as A on AVPU, and I will not do a GCS. However, if this was new confusion, I would perform a GCS. Mavis, have you had your blood glucose tested recently?
No, I don't think so.
Okay, well I'll ask your GP if that's something you require checking. I'm going to move on to the exposure part of your assessment now, and we'll take your temperature. Have you had any hot drinks in the last 20 minutes?
I haven't, no.
So first, I'm just checking that there are no wounds or swelling on the forehead. Your temperature is 37.2 degrees, which is within normal limits. Mavis, I'd just like to check you for rashes and lumps or bumps. Would it be okay if I pull up your top at the front and back so I can have a look?
Yes, that's fine.
It all looks fine. There's no signs of rashes or anything abnormal, either on the front or back. Do you mind if I take a quick look at your legs as well?
Yes, that's fine.
Okay, your legs are pink, warm and well perfused, with no signs of rashes, bruises or bumps, swelling or edema. In clinical practice, I would expose the patient from top to bottom. Mavis, I know you already confirmed that you have an allergy to penicillin. Can you tell me, are you on any medications at the moment?
Yes. I take levothyroxine, 100 micrograms once daily, and also lorazepam, 1 milligram once daily, and donepezil, 5 milligram once daily. I also sometimes take paracetamol if my joint pain is bad.
And how's your joint pain today?
It's normally a bit worse in the morning, but it's not too bad for today.
If you had to rate your joint pain on a scale of 0 to 10, where 0 is no pain and 10 is extreme pain, how would you rate it?
Maybe a 2 or 3, but usually when I wake up it's a 4 or 5.
Do you find that paracetamol is helping you to manage your joint pain?
It helps a bit, but not a lot.
And do you need any painkillers for now?
No, I'm okay, thanks.
Do you have any past medical history I should be aware of, Mavis? Have you been in hospital before, or have you had any long-term illnesses?
I suffer with low thyroid, which is why I take my medication. They also told me I've got problems with my memory these days. I know I forget more than I used to.
I see. Any other medical history?
No.
And when was the last time you had anything to eat?
I'm not sure, to be honest.
I know your son is worried about you because you keep forgetting to eat. Is that right?
Oh, he's a worrier. I'm sure if I need to eat something, I will.
And when was the last time you had anything to drink?
I've got my glass of water here.
How are you feeling in yourself, Mavis? Are you managing everything okay?
Yes, fine, thanks. I don't think I'm remembering things as well as used to. I'm very forgetful these days, but I'm also these things happen.
When you were last weighed, it showed that you'd lost 3 kilograms in the last 2 months. Do you know why that is?
Well, my son keeps telling me it's because he hasn't eaten the meals he has prepared for me.
I see. And are you managing to keep on top of the house yourself?
Well, my son's very good. He comes around each week and helps me to clean and does my shopping for me, as I find it a bit much now with my bad joint.
Do you feel like you might benefit from some help around the house?
Well, that would be helpful, but I really don't want to be a bother to anyone. I really feel bad that my son has to help me. I know he's so busy.
How would you feel about a referral to adult social care? Often they can provide support around the house if you're struggling yourself.
Can I think about it?
Yes, of course you can. I know we've already assessed your pain, but when was the last time you passed urine?
Just before you arrived.
Okay, great, thanks Mavis. What I'll do is I'll just record these observations. I will document all the observations and calculate Mavis's News 2 score to determine the next clinical steps. Mavis, you have a News 2 score of 0, which means that the assessment I've done has been within normal range.
Okay, thank you.
This is the end of my ABCDE assessment. I understand that my colleague asked you a few questions yesterday to assess your cognitive function.
Yes, I think that's right.
I'm just totalling this up now. And so I can see that you have a score of 16 out of 28, which does suggest significant cognitive impairment. I'll speak to the doctor about this, but I think the likely recommendation will be a referral to the memory clinic. Would that be all right with you?
Well, yes, that's fine. It'd be good to have some help with my memory. I know it's been letting me down a bit recently.
I know that must be difficult. If you do want to talk about how you're feeling, we are here to listen.
Thank you.
I can see from my notes that you enjoy a daily walk and also cooking. Is that right?
Yes, that's right, if my joints aren't too bad.
I'm glad to hear that. Before I go, is there anything I can do to make you feel more comfortable?
No, thank you.
Okay, well, just to remind you, my name is Sonna, and please do call on us if you need anything. You have the telephone number of the community nurse team, so call us anytime and we'll be happy to help. In the meantime, I'll refer you to the memory clinic and I'll let them know that you're considering a referral to adult social care. Take care of yourself, Mavis.